The broadcast is now starting. All attendees are in listen-only mode.
Hello, good evening. Happy St. Patrick's Day, folks, and also hopefully happy Match Week for folks. Today we got the secrets of the USMLE. Welcome. We're going to talk about how to dissect any question on test day. We're going to focus on musculoskeletal today. I'd like to welcome you all to this very special session. My name is Tao Lee. I am an associate clinical professor of allergy immunology at the University of Louisville, but many of you folks know me better as the editor for the first day for the the board series, and also editor for USMLE-Rx and ScholarRx and our QBanks and our ScholarRx bricks and RX Coach. So speaking of RX Coach, I want to introduce you to my co-host and co-presenter and one of our top RX coaches, Paras. Paras, would you like to introduce yourself?
Sure, thank you, Dr. Lee. Hey guys, my name is Paras. I'm a dermatology resident here in Dallas at UT Southwestern. I work as an RX coach, so I work one-on-one with students to help prepare them for the USMLE Step 1, Step 2 CK, and I've also helped lead some of the question lab dissections we do Tuesday evenings, and I'm happy to be a part of tonight as well.
All right, so let's get to the agenda. We're gonna talk about what we do. We're gonna talk a little bit about USMLE updates. Later on, we'll talk about RX bricks and how they fit to it, our approaches to questions, then how we dissect questions. Sorry, I should be following here, and then dissection tips and some study tips. And for those who can hang on, we've got a raffle, and a very special offer at the very end we'll talk about, and then we'll open it up for Q&A. So that's our quick overview of what we're going to be doing in the next hour or so. All right, so again, quickly the updates. If you've been to any of our webinars in the last 6 months or so, you probably are familiar with most of this, but I think it's worth repeating. As I think everyone knows, we're going to see Step 1 goes pass fail sometime next year. They are on track to do it by January 2022, but they reserve the option of pushing it back if necessary. So you're going to need to keep an eye on that because we don't know exactly when it's going to happen. One of the most frequent questions we get is what happens to your 3-digit numeric score if you happen to take the Step 1 before the pass-fail kicks in. And the bottom line, it continues to be reported on your USMLE transcript, going forward. And then the last update related to Step 1 is actually a complex level 1. In that, not surprisingly, that exam will go pass-fail also in 2022, but they're scheduling it for mid-2022. While we're not really going to be talking about the USMLE Step 2 CS, since we have, a lot of, international medical graduates and U.S. students who are, figuring this out. I think most of you already know that they have discontinued the Step 2 CS. ECFMG will be making adjustments to their pathways so that IMGs can meet the requirements for ECMG certification to be able to participate in the match. The other thing to talk about, and this has been, well underway for a while, is the USMLE content, blueprint changes. So there have been a number of major changes. So on the Step 1, which we're focusing on, you're going to see more questions on communication skills. You still see pharmacology, but the key thing is that they're doing, much less pharmacotherapy questions. A lot of that has been moved to Step 2 CK. Speaking of Step 2 CK, for those who are also keeping an eye out for that, while there is systems-based practice, patient safety, legal, ethical question, professionalisms in Step 1, it's largely moving to Step 2 CK. So a lot of those changes have been underway, and we're already starting getting some reports that that's what they're seeing. All right, so just keep an eye out for that. And if you're seeing anything different, please let us know because we're trying to keep the intel current for all the test takers out there. All right, and again, as I mentioned, communication questions is a big thing, and we introduced our communication questions, several months ago. We're up to well over 80 communications questions that you can practice with for the step one. So do check it out. All right, great. So before we go into some of the question dissections, you know what a USMLE question looks like, right? So it is a single best answer question, so that simplifies things. You'll find that while about 15 to 20% of them have clinical imaging or some sort of diagram that goes along with it, a few will have multimedia that tend to be fairly, hopefully, basic stuff. Almost all the questions are case-based or they involve some sort of problem solving. That's well over 80% of the exam. And I would say the majority of the questions have multi-step reasoning. So that means that they often integrate, say a question about, maybe some mechanism disease, and then they'll go on to genetics or mechanism disease, and then some pharmacology and so forth. So you've got to be able to, recognize that, and we'll obviously talk about that, in our 7-step approach to dissecting questions. Excuse me. Now, as you may be aware, each step of the USMLE sequence, predominantly focuses on, certain types of content. So for step one, they like to focus on mechanisms of disease, mechanism of action of the drugs, that type of like the genetics and so forth. So again, quote unquote, the classic basic science. Whereas step 2 and step 3 tends to be more about diagnosis and management. That's not to say that there isn't diagnosis, just that there's going to be more of it on the step 1 with regards to mechanism, and you'll probably have some diagnosis as well. All right, so when you see how it applies to the blueprint, as I mentioned, unsurprisingly, a lot of this is about foundational science concepts. As I mentioned, you're going to see more communications and interpersonal skills questions, and you're going to be seeing a lot less about patient management questions. Again, all that, which included some of the, pharmacotherapy in terms of, hey, what specific drug would you need for X, Y, and Z disease, has mostly been eliminated and it's moved to step 2 CK. All right. As I mentioned, we have a relatively new resource. Many of you are actually using it right now, which is a foundational curricular learning system that helps you learn the basics, the core concepts in medical school, so you can not only apply it to the USMLE step 1, step 2, step 3, but more importantly, you apply it to the patient care that you will be involved in. Either currently, in your clerkship, or you will be shortly as you, go through your pre-clerkship, teachings at your school or wherever you're at. And so here's an example of that. So you can see that this is our brick system, and you can see that these are the disciplines that we have that are pretty typical, obviously, what you might be learning in pre-clerkships with disciplines and then organ systems and so forth. We also have some bricks that are created by some of our community education partners. And you can see that it tracks where I left off, and I happen to be in this macroscopic skin lesions, which is going to be a setup for some of the questions we're doing here. And you can see how we clearly, explain and delineate the takeaways that you want to be able to do when you're done with a brick. We always start off with a case connection, so we can allow you to apply it and set up a realistic scenario that you could clearly see in a clinic, wherever you're at, about this infant or this toddler, has a fever and a rash, and what's going on with it, and how do you deal with this rash, right? And then as you go through it, we take a very conversational, very conceptual approach to really explain to you, how you should examine the skin, why should you examine, how do you describe the lesions. It's all well illustrated. It's easy to follow. It gives you the core concepts without flooding you and drowning you in details. And it's interactive, with flashcards. You can see your virtual flashcards. So what term is used to describe a small circumscribed elevation skin with a pure exudate, right? It's a pustule, right? So this clearly, tees off some of the things that you've just been reading here. You can zoom in on the images, so you can take a closer look further in, to see what's going on. And as you progress through it, we have clinical correlations, we have other rich images, we have mnemonics as well too. I think there's one down here somewhere. And high yield tables. And yeah, here's a mnemonic, and you can see it's a classic mnemonic for evaluating a skin lesion. And you can even actually test yourself in this mnemonic, right? What does ABCD stand for melanoma, right? It stands for asymmetry, border color, diameter, evolution. And at the very end, we go back to that clinical case that you were presented at the very beginning of the brick, and then we walk through what a rational explanation for approaching, describing the rash based on what you learned on the brick. So, at the very end, you'll be able to apply this in a clinical scenario. You'll understand how it all fits, and it's not just a bunch of abstract facts. And then you can see that we have a high yield summary of what you should have learned, and then we give you practice questions, that you can, test yourself on. Is this a vesicle? No. And is it a plaque? No. Patches. So you can take multiple tries and then see how you performed and get specific feedback. And at the very end, you can review to see how well you did, check off the learning objectives that you mastered, and then you can actually go deeper into other parts of our system, including first aid, right? So with one click, we can take you to first aid. If you're using the full RX 360 package, and you can see all the high yield facts and images. You can navigate through first aid, annotate it, highlight it, and then when you're done, you can go back to the brick that you started off with, and you can also go to flashcards, videos, and QMax itself, right? But like I said, we're going to save some of that for the dissection. So hopefully you can see how this fits into your preparation for the USMLE as part of a comprehensive foundational review, building up to the USMLE Step 1. All right. So getting back to the dissection itself, at this point I'm going to hand it off to Paras, and he's going to take you through our method for dissecting questions.
Thank you, Dr. Lee. So there are different approaches to board questions, and we'll kind of be going over the approach that we use in our RX coach program. So it's our tutoring initiative, and we'll talk about that later. But for now, we'll go ahead with our 7-step approach, and we'll go over these steps with you now. And then we'll actually do some questions together using this approach so that you can kind of become familiar with it. So the first step, step number 1, is to actually go ahead and cover up those answer choices. You can use a Post-it note, some paper, your hand, whatever you have handy to cover up those answer choices. The reason we ask you to do this is because we don't want you to become preoccupied by the answer choices and have them guide your thinking before you even read the question, excuse me. So this also helps students from being confused or feeling overwhelmed. So now we'll move on to the next slide, and we'll talk about step number 2. At this point, for step number 2, what we will do is we will read that last sentence first. And as we do that, we will highlight and make note of what we believe is important. We do this so that we know what to look for as we read the question. And with any luck, this will help us avoid having to reread the question and waste time. Now we'll move on to the next slide and talk about step number 3. For this step, we'll think about how many steps does this question require to arrive at the correct answer. The USMLE can have 1-step questions, 2-step, 3-step, and what does that mean? Well, let me give you some examples. If a question is simply asking for a diagnosis, that's probably a 1-step question. If it's asking you how to treat that condition, then that's probably 2 steps. 1, figuring out the diagnosis, and then 2, identifying the treatment. If it asks for the mechanism of action of the drug used to treat a condition, well, then you can see there's that extra added step of knowing the mechanism of that drug. So like I said, don't worry too much if you don't remember all these steps. This is just an overview. We're going to be using this as we dissect some questions together just here in a moment. But before we move on, let's talk about why this step is important. Because this step really allows you to have a clear thought process as you approach the question. By knowing how many steps it will take you, your brain will start to think of the things that you need to know, and then you can avoid rereading that question. Okay, and then you can identify relevant clues as well in that vignette. So now we'll move on to the next slide, talking about step number 4. And you will read that question from the beginning, one sentence at a time. And after each sentence, we will highlight and make note of what is important while simultaneously thinking through what we should take away from that sentence. This will help us remain consistent with the question approach and keep our thought process focused. Next, we'll move on to the next slide, talking about step number 5. And once we've read that entire question, we will once again reread that last sentence, the last question, and we want you to start thinking of potential answers and trying to start narrowing those down in your mind. Now we'll move on to the next slide, step number 6. And this is an easy step. You just finally uncover those answer choices. Now we'll move on to step number 7 on the next slide. And for this step, we'll go through those answer choices, but we will start at the last answer choice at the bottom, and we'll work our way towards the top. We do this to make sure that students are looking at all of the answer choices before picking one, and they're not becoming distracted by an answer which they think is correct, but may in fact actually be wrong. So we start with the last answer choice, cross out answer choices that don't fit with what we were thinking, and then hopefully we'll find an answer choice that fits our thought process. Or better yet, you'll find the exact answer on that list. And then we'll select that and move on to the next question. So now that we've gone over our approach, let's do some questions together using this dissection techniques. So now we'll move on to the next slide and we'll approach our first question together. Question number 1. So again, we'll begin with step number 1, which is to cover your answer choices. We've gone ahead and done that. So we'll move on to step number 2. We'll read that last sentence first. Which of the following is the most likely diagnosis? Great, so we're looking at a diagnosis type question. Step number 3 is next. How many steps is this question? Well, I think this is probably a 1 or 2 step question. It may just be a simple rash diagnosis where we have to look at the picture, figure out what the rash is, so maybe a 1 step, or maybe we need to figure out what the rash issue is and then come up with like an overarching diagnosis. So either 1 or 2 steps here. So now we'll move on to step number 4 and we'll read that question 1 sentence at a time. For today, we're going to pause briefly after each sentence to think about what is important, okay? So ask yourself what is important, what is the question asking me, what am I supposed to be picking up on? So let's do this together. So a 3-month-old girl is brought to the outpatient clinic because of a rash on both cheeks. Her mother was a previous intravenous drug user who did not receive prenatal care. The infant was born at home and is being breastfed by her mother. The infant's temperature is 98.6, blood pressure is 113/83, pulse is 110, respiratory rate is 20. She is in the 10th percentile for weight and height. Physical exam reveals the rash shown in the photograph. So now that we've done that, let's move on to step number 5 and reread that last sentence. Which of the following is the most likely diagnosis? Great, so I want you guys to start, thinking about potential answers here, okay? We'll give you guys a second. And now we will move on to step number 6 and we will uncover those answer choices. So let's show them to you now. And here are those answer choices, okay? So we will go ahead and go through those. Answer choice E, toxoplasmosis. D, syphilis. C, neonatal HIV. B, herpes simplex virus. And A, congenital rubella. And notice how we went from answer choice E to A, working our way from the bottom to the top. So we will go ahead and open up that poll. go ahead and select the answer choice you believe to be the most correct answer, and we will talk about it in just a few seconds.
All right, so everybody lock onto an answer, and I'm going to go ahead up with the poll right now. And oops, hold on. I'm going to go ahead and launch it right now. So go ahead and answer the poll. All right, it's taking a little bit of time for the votes to come in, so we'll just keep waiting. About a third of you folks have voted, or at least in terms of vote tabulation, it's in, or we're close to half. So we'll leave it open for about another 10 seconds for votes to come in here. All right, about 2/3 of you have voted. All right, we're about 70%, so I think that's good enough. That's plenty of responses from you folks. And remember, on the USMLE, there is no penalty for guessing. So you should never leave a question blank, okay? All right, so let me go ahead and close the poll and share the results. And let's see, hopefully everybody can see the results. You can see it's actually a horse race between B, herpes simplex virus, and C, neonatal HIV with it. But you know, also a number of folks looking at A and D as well too. So let's go ahead and get back to this and then look at the answer, which is C, neonatal HIV. So this will be interesting. Let's go back and discuss it.
Yeah, thank you, Dr. Lee. Great job, guys. So this baby's rash, actually what we're seeing there, really should be thinking about an infection, and that's probably a Staph aureus infection. You can see all of that, what they call honey-colored crust, which indicates impetiginization, or like a staph secondary infection of that rash. So that honey-colored crust, really start thinking about staph, okay? So this patient has a staph infection. We know they're at low weight, low height, and there are several risk factors for an immunodeficiency. The mom is a drug user, no prenatal care, home birth, okay? And then having HIV obviously increases your risk of infections. So neonatal HIV is commonly manifested with numerous infections, skin infections, lung infections, lymphadenopathy, and also failure to thrive, so low body weight, low height. So that's probably what the best answer in this question. So talking about the other answer choices, toxoplasmosis. So keep in mind those main manifestations of that would be chorioretinitis, intracranial calcifications, hydrocephalus. You know, nothing about that in this vignette or the picture. D, syphilis. That presents with cutaneous findings, but a lot of different ones. You know, teeth abnormalities, what they call Hutchinson's teeth, saddle nose, issues with the shins. Nothing in the vignette or the picture about that. HSV, really you should be looking for vesicles, like a vesicular rash. And then also you can have encephalitis or meningoencephalitis, so that may be provided in the vignette. And then A, congenital rubella. Keep in mind that classic triad they talk about: deafness, cataracts, patent ductus arteriosus. Nothing given to us about that. So the best answer choice here would be picking up that this patient has some sort of immunodeficiency, likely neonatal HIV, given by the mother's risk factors from the vignette. Great, so we have done one question together and we've kind of gone over our approach and utilized that approach. So let's move on to the next question and do another question with our approach. So once again, step number one, cover up those answer choices, which we've gone ahead and done. We will then move on to step number two, and we will read that last sentence first. Which of the following describes the mechanism involved in this patient's skin condition? Great, so probably looking at a nice pathophysiology question. So let's move on to step number three, figure out how many steps does this question require? Well, I think this could maybe be a two-step question. I think knowing that patient's skin condition, step number one, and then two, what is the mechanism in that skin condition? So we're going to take the fact that we need to know two steps, and we're going to try to pick up on those clues that they're giving us in that vignette, okay? So let's move on to step number 4 and read that question one sentence at a time. And again, I'll kind of pause briefly so we can all kind of gather our thoughts and try to wrap all the clues together, okay? So a 4-year-old boy is brought to the emergency department by his mother because he has had pain in his right knee for 2 days. His mother mentions that the boy had a fall 5 days ago. His mother also mentions that he has a history of easy bruising, tingling in the limbs, and recurrent skin and respiratory infections. She is not currently giving him any medication. The patient's temperature is 101 degrees Fahrenheit. On physical exam, his right knee is found to be warm and tender on palpation, and he has pale skin and blonde hair. Great, so now that we've read that question, let's move on to step number 5 and reread that very last sentence. Which of the following describes the mechanism involved in this patient's skin condition? And I'm sure a lot of you are starting to come up with diagnoses in your head, but remember, there's a second step here. It's not just the condition, it's the mechanism, okay? Just start trying to think of that mechanism that could be involved as well. And so now we will move on to step number 6, and we will uncover those answer choices. So we'll show it to you now. And then for step number 7, we're going to start at the bottom and work our way up in terms of looking at those answer choices. E, tyrosinase deficiency. D, phenylalanine hydroxylase deficiency. C, mutation of the X chromosome. B, microtubule dysfunction. And A, autoimmune destruction of melanocytes. So go ahead and start thinking of what you think is the best answer in this question. We will open up that poll. Go ahead and select the answer you think is your vote, and we'll talk about it in just a few seconds.
All right, hopefully everybody's got a question, an answer locked. And remember, there is no penalty for guessing. So let me go ahead, open up the poll here, and again, once you locked in an answer, go ahead. So here we go. Poll is open. Go ahead and make your choice. And again, no penalty for guessing. One of the things I'll talk about while you are, while you're putting in your choices is that, again, on the USMLE Step 1, you've got 40 questions in 60 minutes. That gives you 90 seconds per question. And we often advise that you try to lock in an answer within 60 to 75 seconds. So that way you'll have, 5 to 10 minutes left over to go back for, questions, to tackle questions that you think are solvable, that you've marked, but you weren't 100% sure, of the answer. Just remember that you don't mark too many questions, because again, you won't have enough time to look at all the questions again. All right, we're about 60% voted. Opened up for a couple more seconds. Again, no penalty for guessing. All right, I'm going to go ahead. I've got 2/3 of you have voted. We're at 70% now, so I'm going to go ahead and close and share. And this is definitely a tough, this is challenging for you guys. You see answers all across the board. Every option got at least 10% actually. But the ones that broke the 20% mark was B, microtubule dysfunction, D, phenylalanine hydroxylase deficiency, and E, tyrosine deficiency. So this should be an interesting discussion. So let me go ahead and close the answers, and let's see what the actual answer is. And it is actually C, mutation of the X chromosome, actually the one that not many people were thinking about. So back to you, Bras.
Thank you, Dr. Lee. I think this answer choice may actually be B, microtubule dysfunction. So I apologize for the bolding error there, but this is actually B, microtubule dysfunction. Okay.
Yeah, I thought so too. I was wondering about that.
Yeah, this patient is a 4-year-old boy. He has a history of tingling in the limbs, easy bruising, and recurrent skin infections. He has pale skin and blonde hair, And based on these findings and the patient's physical appearances, the most likely diagnosis is Chidiac-Higashi syndrome. So this is an inherited autosomal recessive condition where you have abnormal cellular trafficking, okay? So a defect in a specific gene, the LYST gene, leads to microtubule dysfunction, specifically in the lysosome and the phagosomes, okay? So thus, what you end up having is you have a patient that progresses with neurodegeneration, albinism, like this patient with pale skin, pyogenic infections, like this patient with recurrent infections, and then bleeding tendencies as well, which the mom reported was a concern for her. So that would be the best answer here. Well, let's talk about the other answer choices real quick. Answer choice E, tyrosinase deficiency can lead to albinism, but the patient's other symptoms like recurrent infections wouldn't be present, so that's not the best answer here. D, phenylalanine hydroxylase, that presents with intellectual impairment, seizures, and then musty body odor, which the patient may also have decreased skin pigmentation, but they should also have other findings that we're not told about. Answer choice C, mutation of the X chromosome, that's commonly leads to Fragile X syndrome. Patients would have certain craniofacial abnormalities like microcephaly, long facies, macroorchidism, which we're not told about here. And then lastly, autoimmune destruction of melanocytes, that's getting at vitiligo. So vitiligo, you do have actually complete depigmentation or loss of color in areas, but you wouldn't necessarily get recurrent infections and bleeding tendencies. So the best answer choice here is knowing that this is Chidiac-Higashi syndrome, which is caused by dysfunction of the microtubule system. So great job there. I think that was the most highly selected answer. I know it was a tough battle between the 5 choices. So let's move on and do our last question together using our dissection technique, and hopefully you guys will be pros in using our approach. So once again, we will move on to step number 1, and we're going to cover up those answer choices, which we've already done. Step number 2 is we're going to read that last sentence first. Which of the following is the most likely diagnosis? Great, so another diagnosis question. So now let's move on to step number 3 and figure out how many steps does this question require? Well, I would say probably a 1-step question. I think we need to come up with a diagnosis based on a lot of the clues that they're going to give us in that vignette. So it's going to be important that we put our detective hat on and we start to look for those clues and tie them all in together. So let's move on to step number 4 and let's read that question 1 sentence at a time. A 55-year-old homeless man is brought to the emergency department because of hemoptysis. He has a history of HIV infection and has not taken medication for years. He uses intravenous heroin regularly. He also says that he has back pain, which has been worse during the past month. He reports fatigue, fever, and night sweats during this time. His temperature is 38.9 or 102 degrees Fahrenheit. Blood pressure is 140 over 90. Pulse is 120. And a respiratory rate is 24. Physical exam reveals decreased breath sounds over the apex of the right lung, and his back is tender to palpation over the lumbar spine. The chest x-ray is shown. So now let's move on to step number 5 and reread that last sentence. Which of the following is the most likely diagnosis? Great, so once again, I want you guys to take a second, start coming up with the diagnosis of what you think may explain the things that are being told to us in that vignette. And now we'll move on to step number 6 and we'll uncover those answer choices. So I will go ahead and show them to you now. I see that there's actually 2 answer choices there for osteomyelitis. So let's go ahead and cross off answer choice D. And then we'll just, if you think osteomyelitis is the right answer, just go with C, don't select D. And once again, I will go ahead and start at the bottom and work our way up. Answer choice E, pneumocystis pneumonia. C, osteomyelitis. B, multiple myeloma. and A, metastatic bone cancer. So I want you guys to start coming up with what you think is the most likely diagnosis, and we'll go ahead and open up that poll, and we'll talk about it in just a few seconds.
All right, let me go ahead and open the poll. Hopefully everybody's is locked in an answer. Let me, oops, sorry, wrong one, sorry. Wrong button. Here we go. Let me go ahead and open it up. Here we go. Go ahead and give us an answer. A, B, C, or E. Don't click D. All right, close to half of you folks have answered. That's great. Keep it going. Keep it going for about another 5 seconds. About close to 2/3 have answered. All right, great. All right, 70%. So I'm going to go ahead and lock it down and share the response. And what we see is roughly half of you are saying pneumocystis pneumonia. And then about a quarter of you folks are saying osteomyelitis, and then we've got a smattering among the rest. All right, so let me go ahead and hide that. And let's go to the answer. Hold on. And the answer is C, osteomyelitis. So let's definitely talk about this.
Yeah, great job, guys. So this also is a good question that they like to ask. So this patient has a chest x-ray given to us, and hopefully you can see that there's something funky kind of going on at the very apex of the lung. And that's what they would call like a cavitary lesion, almost like you can see like a round structure within the lung at the very top. We know he's HIV positive, but not currently on medication. So we should really be thinking about tuberculosis, okay? Tuberculosis occurs a lot of times in immunocompromised patients, patients with HIV, drug users, homeless patients, and this patient's back pain. Why are they telling us about back pain? Well, that's probably due to tuberculous osteomyelitis, or the name that you guys may know more familiarly, Pott's disease. So it's a form of tuberculosis where the infection kind of seeds into the vertebrae of the spine, usually the lumbar spine, and that's why it's painful, okay? So the best answer choice here is osteomyelitis, or an infection of the bone with tuberculosis, also known as Pott's disease. Answer choice E, you know, the respiratory symptoms and the comorbid conditions can lead to a picture of pneumocystis pneumonia, which is common in HIV patients, but it wouldn't cause the back pain. Okay, so it was important to pick up on what was happening with that back pain. Answer choice B, multiple myeloma. So those patients can present with back pain because we do know that you can get metastasis or lesions involving the spine, okay? But patients may also present with other things, calcium dysfunction, anemia, and on top of that, they shouldn't really have this cavitary lesion in the lungs, okay? So multiple myeloma, probably not the best answer. Answer choice A, metastatic bone cancer. So there are a couple types of cancers that like spreading to the spine, especially the lumbar spine, and that would be prostate cancer and breast cancer. However, this patient's not presenting with any urinary issues, no palpable breast masses, and again, the chest x-ray wouldn't fit with that as well. So the best answer choice would be osteomyelitis from a tuberculosis infection. So great job today, guys. Hopefully you guys were able to get the hang of our approach and it became familiar to you. And I will hand it back off to you, Dr. Lee.
Yeah, the other thing I'll just mention about, pneumocystis pneumonia patterns, and fortunately I haven't had to see any lately, but it typically, it tends to be more of a diffuse pattern. So you can see more, bilateral, kind of covering most of the lungs, tends not to be super focal. Even you couldn't pick up the cavitary lesion, tends not to be like, even a lobar pneumonia, but you can tell this is really high. So making this more suspicious for, TB, cavitation and all that, because it tends to be, again, to be in the, high upper lung fields. All right, so that's just the other takeaway with, pneumocystis pneumonia. All right, great. Thanks, Paras. This was, I think, a fantastic discussion. Hope everybody got something out of it. You saw, like, how we can break down multi-step questions using this 7-step strategy. So, as you can see from what Parasa did, he made sure, you got to use the standardized approach. As he said, there are more than one way to do it, but we like our 7-step approach. It's very systematic. You're not going to let anything slip through the cracks if you do it that way. When you are selecting the answer, remember we asked you to go from the bottom up, and I noticed a number of folks asking, well, why do we need to go from the bottom up? Because again, it forces you to look at everything. It's kind of like reading a sentence backward. It forces you to actually focus on the words as opposed to assuming you've read it going forward, which can happen when you go from A to E. You might accidentally skip over, one of the options. And the other thing we talked about, that ties in with multi-step integration is that, the USMLE likes to test related concepts, together. So ergo, really understanding how to break down, those types of questions. All right. When I also give my talk about, USMLE Step 1, about if you go to the, Path to 250 talk, there's a couple of general pieces of advice that the RX coaches, advocate for and have found to be helpful for students over time. One is to establish a study schedule and stick with it. Next is to integrate everything. Sorry, this is slightly out of date. Which we were just talking about. So integration, right? And for particularly for multi-steps. Sorry, my handwriting is kind of bad on a touch screen here. There are certain topics that are crammable, like biochemistry, pharmacology, microbiology, that tends to end up, that tends to have repeatable concepts. And so while you don't want to cram, if you have to cram something and you've got some flexibility in your schedule, you might want to put metabolic pathways, bugs and drugs towards the end. All of you are in med school or have gone to med school, so it's really important that you focus on what you've learned before. Obviously, we can tell you what's high yield, but combining it with what you previously learned makes it so much easier because you've already learned it before. We also want you to make sure that you don't overschedule. There's a lot, there's a tendency for us to burn ourselves out by trying to, study 12, 13 hours a day, particularly during the dedicated periods, or even if you have months to prepare for it, there's a tendency for us to overdo it. So make sure you space things out. Make sure you, take time to be, a regular person with significant others, friends, that type of stuff. And make sure, make sure you also scheduling gap days that number one, you can either use as a break or you can use to catch up if somehow you're off schedule just a little bit. In the front of the book, right after the acknowledgments, we have this checklist that'll help you stay relaxed and grounded as you prepare for the boards. And again, whether you're starting like a couple months in advance or many months in advance, it's always good to have a plan. All right, great, fantastic. All right, so speaking of changes, to the Step 1, we've also been changing as well too. We've been really keeping an eye on what's been going on, as you could tell, with all the USMLE changes, particularly the blueprints, and to over the last 6-8 months. Now, what they hadn't told you, and it's what's not obvious until you actually dig into the the newer questions that are coming out, specifically in the sample questions, and it's not even really reflected yet in the CBSSA, the NBME release forms, is that the questions have gotten a lot shorter and a lot more focused. So they've removed a lot of the extraneous information and also the pertinent negatives that you would normally expect to see there. Or if you're used to clinical medicine, if you've been on the clinical wards, you know how we talk about pertinent negatives, about helping you guide you to a diagnosis or a treatment path. Those are largely stripped out of the step 1 questions. They're a lot shorter. They're a lot more succinct, right? So keep that in mind. They're not these big, bulky questions anymore that you might have been seeing. And so we recognize that, and are actually probably one of the first people to implement these changes. So starting now and rolling out over the next several months, you're going to see, shorter, more focused questions that are much more USMLE-like and much more authentic to the USMLE of 2021 versus what was being tested last year or even the year before. We're going to be adding more challenging distractors so we can give you more teachable moments, and so you get a higher yield out of each of the questions, right? So you learn not only from the correct answer, but you'll learn from the incorrect answers and the rationales for why they are incorrect, right? Just as, Paras was talking you through this. You'll also see that we now have, detailed, multi-step explanations that takes you through the logic. We're one of the first to be able to do this, in a way that's very logical and very focused, actually how a clinician would do it. And this will actually help you set up for the step 2, because almost all of the step 2 questions have some sort of multi-step. They'll start with a diagnosis or treatment, diagnosis or mechanism, diagnosis and side effects. Almost all the step 2 CK questions are multi-step. So this is going to get you in the right position for future USMLE exams, including, such as step 2. And then RX brick integration. You saw how useful RX bricks can be for foundational learning. And so if if you are struggling with a question, we can quickly reroute you back to that foundational part of your curricular experience to re-experience it. So now you'll understand, what the challenge is going forward. So here's an example of that. So you can see that sorry, hold on, make sure I got this the right one. Yeah, here, this is the right one. So you can see that this is actually a medium length question. Some of them are actually shorter than that, because again, they're going to be giving you examples where where there may be not as much physical exam findings or laboratory tests or whatnot. But you can see there's nothing about pertinent negatives here. It's pretty well tight and organized and so forth. You can see that we have six choices for you to look at, right? And when you look at it, a lot of these things can be potentially the answer. And then when you attempt the question and then you get the feedback, once you look at it, I don't know if I can zoom into this or not here. Oh, I think I can. Yeah, you can see I can. You can see that we've basically we're able to dissect this. We were able to tell you that this is a hold on, let me see if I can get the pen here. Let me use this pen here. You can see that this is a step 1 is the pharmacotherapy, not quite the pharmacotherapy, because it's really more about the class, right, as opposed to the drug. You had to identify the class, so it is kind of pharmacotherapy, but not quite, because again, most of the specific pharmacotherapy, like the specific fibrate or whatever, is moving to step 2 CK, and then drug mechanisms, because once you figure out what the class of drug is, then you have to back figure what the drug mechanism. And no kidding, this is actually what they're doing on the step 1. It sounds a little goofy and not what you expect in real life, but we kid you not, this is what they're doing. And so we're giving you plenty of practice to really be able to nail down this experience. And then we provide a short explanation for why the other choices were not the best choices. Okay, let me go ahead and erase that, and then oops, sorry. let me get back to erase that and and then you can see over here, once you get to the bottom line, once you get to the explanation, we also now link in the relevant bricks. So in this particular case, anti-hyperlipidemic drugs and the lipoproteins. So you can review all the foundational stuff. If you want the linkage to what's high yield, then you can also see the linkage to first aid as well too. So so deeper, deeper set of references and resources that's contextualized, based on the question and how you're answering it. So we hope you really enjoy these new upgrades to the to QMax as it rolls out. And let me zoom out here. And what you're going to see, hold on, sorry, trying to manipulate all these buttons here is a little challenging. So what you see is that we already launched it for cardiovascular and renal, so that's already live. And more questions will be coming out every couple of weeks or months or so. We expect to mostly have this rolled out by early summer. So do enjoy, and please give us feedback as these new improved questions continue to come out. So thank you very much again for your time. I'll just a couple more words about the Rx Coach team. Obviously, you got some direct experience with Paras, who did basically a little bit of group coaching tonight, right? This group is been around for over a year. This is a group of very high performing tutors and residents who can provide personalized coaching and so forth. They are they work within our system that includes an assessment that's unique, that allows you to diagnose where you're at. They can develop a personalized study plan. Obviously with the tutors, we have a fairly sophisticated one-on-one approach to working with you. All of them are trained and certified in our system, and they integrate the learning with our best of class, question bank and bricks, and if you're using R36, and integrate with first aid and our videos and flashcards. And students have had great outcomes with them, getting anywhere between 30, sometimes as high as 60, 70, 80 points, higher on the boards from where they started. So do check it out at rxcoach.com. -coach.com to schedule a free, no cost diagnostic assessment where they'd be willing to talk to you and see how they can help you. All right. And so again, you can reach out to us there, but obviously you can reach us through social media, on Facebook, on our blog, Twitter, Instagram, YouTube. In fact, I'll go to our blog because that's also a great resource as well too. Let me see if I can get to it. Yeah, here we go. So go to firstaidteam.com and you can get great article on preparing for the USMLE Step 1, including test prep advice, study bonus content that includes where is it? Sorry. Oh, here we go. The study planner, which I think Jeff is going to drop the link in. The Section 1 supplement, which for IMGs is a great, specific information on preparing for the boards if you're outside the United States or if you're a U.S. student who went to an international school, right? So there you go. Also, if you're osteopathic or podiatry. So it covers a lot of different situations, and then our top-rated review resources as well. And then getting back to here, we've got a couple other free resources that we want to draw your attention to. We've got a general micro course of bricks that you can get for free just for creating a free account. Go to USMLE-Rx.com/micro to get that at no cost. So just with having a free account, and that you also get biochemistry bricks as well too. I should just mention. And then we have a brand new, podcast, offering, so you can listen to our bricks, to some of our bricks, and there are more being added every week, especially if you're kind of an audio learner. This is great for if you're jogging or you're taking a walk, if you want a bit of a break from, heavy duty, question bank, testing and stuff like that.